The trail of destruction left by Cyclone Dineo, which ripped through Zimbabwe in February, and before it, weeks of heavy rainfall. Apart from collapsing homes and infrastructure, the wet spell has created ready breeding grounds for malaria-bearing mosquitoes and stoked a deadly outbreak.
We have seen an increase above the usual when we compare in the past 5 years.
Since 2000, Zimbabwe had lowered malaria incidence by 79%. But preventive efforts of spraying homes and distributing mosquito nets have been wrecked by the extreme weather.
The flooding that has happened as well as cyclones meant people were moved from their homes that we actually had sprayed. And they're going to find shelter somewhere else, temporary shelter where we had not planned that they would be there. And the protecting mechanisms may not necessarily have been there on time.
The Ministry of Health's malaria unit has been tracking new infections on a weekly basis and has responded by scaling up distribution of test kits and training community members to test for malaria.
We do have adequate anti-malarial medicines that we can assure the nation and the people. But when you have outbreaks, it means you have suddenly got an increase beyond what you forecasted sometimes. And you may run out of other commodities. But I want to assure the nation that we do have enough medicines.
Zimbabwe has joined hands with other countries in the SADC region, also affected by the heavy rains, to manage cross-border spread of the disease. Farai Mwakutuya, CGTN, Harare, Zimbabwe.